On a day in which the President of the United States sat down with Republicans and Democrats in Washington to try to find common ground on the health care deliberations in Washington, on a day in which our two Commerce committees of the House and Senate sat down with our own insurance commissioner and with representatives of the largest health insurance carrier of the state, Walmart, asking questions about large premium increases in the individual and small group plans. We are introducing and hopefully debating for the fourth year in a row health care reform in this state. While they're trying to find solutions in Washington, we in Iowa have been making solutions and making decisions. Over the past 4 years, we have made a commitment both in money and in statute that almost every child in this state will have health care coverage by the end of this year. We have extended health care to more Iowa adults than in the past. We have created and expanded the Iowa Care program to provide direct services to low income. Now we have a bill in front of us that will do several more things. It will expand Iowa Care so that every Iowan will be able to go to their local hospital for emergency services. As of today, those Iowans have to go to either Broadlawns or the University of Iowa hospitals and clinics. It will make health care for the emergency services much more accessible. Secondly, it will provide a network of primary care providers at our federally qualified health centers, 14 throughout the state. These Iowa Care members will be able to be assigned a primary care doctor or nurse practitioner so that they will have direct primary care deliberations and consultation. It will establish an Iowa exchange where we will have a clearinghouse of all health care plans in the state, public and private, so that the average Iowan, the uninsured Iowan, the Iowan who already has insurance but is finding it too difficult to maintain their premiums in that plan, can compare plans throughout the state. That will be, with amendments approved, that will be available and housed in the Insurance Commissioner's office. And with the amendments that we've proposed, it will allow Iowans who are employed but unable to afford their employer's share of the premiums, it will allow the Iowa Care premium subsidy to go directly toward the private market insurance plan. It will allow individuals who want private insurance, who are between 200% and 300% of poverty, for their subsidy to go directly to a private health insurance plan. And you have to have proof that you've gone to a private insurance health plan before you become eligible for Iowa Care Plus, which will be the insurance of last resort for Iowans. Ladies and gentlemen, we made a plan and we made a commitment that by the end of this year, we will have a plan for adult Iowans, uninsured Iowans. The number of uninsured Iowans has already increased from last year, from 286,000 to over 308,000. While we have done such a great job on children, we have done very little for adults. And yes, we could wait for national reform, and yes, I believe it's going to happen, but this provision and the provisions in this bill will allow Iowa to march forward, with or without national health care, so that we can show that states have the innovations and the creativity to protect the citizens here in this state. Ladies and gentlemen, this is not a debate about public options or national health reform. This is about lives of our Iowans, of our constituents, of our neighbors, and maybe even our own friends and family members. Ladies and gentlemen, I want you to listen carefully to the debate. There are amendments, and we will be able to have, I hope, a dialogue in which where we listen to each other, we can understand and work our way through this complicated health care reform piece of legislation. By listening to each other and not to an uninformed lobby, we will be able to be pretty proud at the end of the day. Thank you, Mr. President.